Okay, so I welcome you all to this wonderful case study, case study training. So this is one of the very unique training program, a very unique training program, which is going to run for 1 year. So what is that we are going to do? Monthly once we are going to meet through Zoom, and daily we are going to interact uh, in the WhatsApp group, wherein we are going to discuss about the cases. So today, so this has to be interactive. So today we are going to discuss about some case study and how that we can plan intervention, what therapy we can use. So here I will play the role of a facilitator rather than a trainer. In case study, what we will do is we will incorporate the ideas of everyone. Everybody knows something. So here it is not actually a listening program. It is not a listening program. It is actually a program wherein you will also contribute. So today we are going to see a case study and also we are going to discuss. So how many of you are able to discuss? Sir, I will be able to talk. If you are able to talk, please put a T in the chat box. Please put a T in the chat box if you are able to talk. So out of 42 people, there are only few people who are ready to talk. Okay. So usually one of the aspect as far as the counselors or psychologists or psychotherapists, the challenge is how to proceed in the counseling in the initial stages, in the middle stages, what is to be done, how to end the counseling, when to end the counseling, and what kind of therapy to be used. So this is the dilemma people used to get. Now, for example, I will tell a case. You try to guess what is the problem, for which what kind of therapy is suitable. Okay. So the case is like this. Okay. Yeah, a middle-aged person. Okay. He was having a problem in the heart, cardiovascular issue. So he was admitted in a hospital for open heart surgery.
He said, no, I have a deputation working there.
So he has undergone an open heart surgery. So he was given anesthesia. He was given anesthesia. And after giving anesthesia only, the once again. Okay. Sir, please share your slides. Salma, this is not a slide program. This is a talking program. Okay. How many days, just like children, we will be reading the PPT? Yeah? Yes, he was given anesthesia. But hello? What happened? But what happened? During the end of the surgery, he regained consciousness.
कुछ case study पर meeting
So,
है.
what is evident is people are engaged in their own work, but they are not attending the training program. See,
ये क्या है मतलब ये एक psychology का
so this is, I think, my time is going in muting the people. So the last 15 minutes, he regained consciousness. He was not able to tell the doctors and other attendants that he has regained consciousness. He was able to see whatever is happening. They were stitching and they were using the cloths, the blood stains, everything he is able to see. But the thing is, he is not able to communicate. He is not able to communicate that he has regained consciousness and he was watching everything. And that has created a problem in him. After the surgery was over, physically he was all right. The operation was successful, but the thing is, he was not able to sleep in the night. He was not able to sleep in the night. After the surgery, for first 15 days, he was given sedatives to sleep. So first 3 days they gave. Then he used to tell, I couldn't sleep. So they started giving him sedatives. So the first 15 days, he was in sedative and he slept. Then afterwards, he was discharged. In his home, he was not able to sleep. And the doctor has identified that the problem is something else. Okay. So what is this problem? What is what may be his issue?
Post-traumatic stress disorder.
So that is a post-traumatic stress disorder. Okay. For how many of you were able to understand, okay, this is PTSD? If you are able to, even when I was telling, just like Rachel, if you were able to understand that, okay, this may be PTSD. If you know it, that means that is one of the situation, one of the status in which you are in as far as psychology is concerned. The another aspect is you do not know what may be the problem. You are not able to guess. Okay. If you have guessed, please put G. If you have guessed, please put the G. If you couldn't guess, please put the D in the chat box. So most of the people, 3, Srisha, Attila, Afrin. So there are some people, they were not able to guess, and some people, they were able to guess. Okay. Now here actually I will not be discussing in the case study, because the case study program will be for 1 hour. I will not be able to discuss about all the problems and all these aspects. Here we are going to discuss about the problems and what kind of interventions and the case study. Okay. So today, please go and search what is PTSD and share it in the group. What is PTSD? What are the DSM criteria for PTSD? Read and share it in the group. So here, actually in the group which we have created for the case study, 1 month, what will happen is we are going to discuss. So it is not that I will be taking a class then. No. We are going to discuss. So what we will discuss? We will take one case. That one case we will discuss for 1 week completely. For example, the complete next week we will be discussing about PTSD. So PTSD relevant details, everybody will share and spend 30 minutes every day to sit in that group and read it. So that you will be able to understand, okay, what is PTSD, what people understand, what are the simple aspects about PTSD, how to identify PTSD, all these aspects. Whatever you read now, which you feel very important, share it in the group. So 1 week completely we are going to discuss only about PTSD in the WhatsApp group, not on the Zoom. Monthly, only once we will be meeting in Zoom and we will try to fix up the cases for the ongoing discussion. Now PTSD. Okay. Which therapy, Balakrishnan? Balakrishnan, 1 week. 1 week, one case. So in a month we can discuss 3 cases. Okay, PTSD. Which therapy is the best for PTSD?
So, cognitive processing therapy.
Idishri, can you repeat?
So, CPT, cognitive processing therapy.
Acha, okay, anything else? CBT, Ikra says CBT, CBT. Shamina, relaxation and mindfulness, it is a technique, it is not a therapy. So, exposure therapy. Mansi, this is for everybody. Anybody can, even the 11th standard psychology student, they should know what is PTSD, na? Isn't it, Mansi? And one of these aspects, Mansi, don't think, see like this, whether it is pertaining to first year, second year, it pertains to psychology. That's all. Whether something is related to psychology, that is what we have to think. So, people have put various aspects. One of the therapy which is used in PTSD is CBT. CBT. Now let us take the case of Raj. Okay, Raj. Suppose if we are using CPT, suppose if we are using CPT, how that we will proceed? So, can anybody share? Suppose if we are using CPT, how that we will proceed? If you know, please put K. If you do not know, please put D. That was very nice. Trauma informed therapy also can be used. NLP can be used. CBT can be used. If you know, please put K. If you do not know, please put D. Okay. So whoever knows it, please share. Sherwani, can you share it? In CPT,
Yes,
how that we will handle this case?
Yes, sir. Good evening, sir. So, firstly, we will try to have a chat with the person. We try to talk to them. We try to analyze what all are the external and internal triggers that might help that might lead to relapse. And then when we analyze those triggers, we allow him to understand that over time, with practice, with exposure, we can actually help him to overcome the fear which is encompassed in the triggers.
Okay. So, okay. So Shweta Singh says first take case history of the client. Okay. Then people say rapport building. Okay. So first we will try to build rapport with the client. First rapport building with the client. After rapport building with the client, we will be trying to understand what is the issue. What is the issue? After understanding what is the issue, what is the next step? Sherwani has told the longer picture. Okay. Step by step, if we see first rapport building, then we will be discussing with the individual and try to understand what is the issue. We have understood the issue and it is PTSD. Okay, suppose you come to the conclusion that PTSD. To come to the conclusion whether it is a PTSD or not, whether you will use any questionnaire, yes. If so, what questionnaire you will use it? What is the name of the questionnaire? Because first we have to understand whether it is PTSD or not. What is the questionnaire we will be using? So
But
we have something called PTSD checklist. Okay. Somebody is talking.
intrusive thoughts coming or not?
Yes. So the first one is assessment. The client comes, we do the rapport building. When the client talks, we understand that okay, he is having this may be PTSD. No, this is not just a guessing. Whatever we guess, we have to check assessment. So for PTSD, there are several assessments. Okay. So this is one of the assessment. Okay. This is one of the assessment which is being done. So can anybody read this? Can anybody read this?
Instructions
No,
below.
from in the past month.
Okay.
From in past month.
In the past month, how much were you bothered by? First, repeated, disturbing, and unwanted memories of stressful experience. Second, repeated, disturbing dreams of stressful experience.
So
Third.
that will be the client. We will ask the client to rate it in 1, 2, 3, 4, 5 in this scale. So suppose a client who gives a 4 extremely for everything. What is that meaning? Suppose for all the repeated disturbing dreams I am getting, I am feeling very upset. I have a very strong physical reactions. I try to avoid the memory thoughts. For all these aspects, he is putting extremely 4, 4, 4. What will that be mean?
He's in high trouble. I mean, see, problem is more
So he is having more
problem.
problems. He is having more problems. So this, how many of you have seen this checklist? Completely studied this checklist? How many of you have gone through this complete checklist? If you have gone through, please put yes. If you didn't gone through, please put a D. If you have gone through it, please put yes. The complete questionnaire. So case study program. Actually, I will not be training because see, we are collecting a very lowest amount. It is contributed training. So I will not be sitting and guiding you everything. Okay. So in the group, what we will do is we will be sharing the information. These are the things to be done. For example, this questionnaire now I will share. Okay. Now the thing is, a psychologist should go through such questionnaires. Yes or no? Yes or no? So the first one is the rapport building. First, we will build a rapport. Then we will try. We will talk with the individual. We will try to understand what is the issue. After understanding the issue, we will administer the proper questionnaire to assess the level of the intensity of the issue. Assessment. From the assessment, we will be able to understand. From the assessment, okay, what is that? Suppose if somebody gives extremely for everything, what kind of interventions he requires? Somebody gives extremely for everything. Somebody gives extremely for all these aspects, for all the questions, then what kind of interventions immediately he requires?
So along with CBT, he needs some anti-anxiety medications also, sir.
So,
Yes,
as Suganya Venkatesan says, if he takes extremely in every aspect, immediately he should be referred to a psychiatrist. then it is not the job of the psychologist or even clinical psychologist, because a clinical psychologist cannot give medicine. Can a clinical psychologist give a medicine? No.
No.
If somebody takes extremely for all these questions, that means he is not able to sleep. He is not able to sleep, and he is getting a problem in his day-to-day activities to do it productively. So, medication as well as counseling should go together. So one of the aspects is every psychologist or clinical psychologist, they should have a tie-up with a psychiatrist, so that when you get a case, you can refer to the psychiatrist. When somebody comes to psychiatrist directly, he will refer you the clients. How many of you have a MOU with a nearby psychiatrist? If you have, please put yes. If you don't have, please put D. If you are practicing as a psychologist, if you are practicing as a psychologist, if you are doing counseling, you should have a tie-up. You should have a tie-up with a psychologist. Suppose, for example, you are a psychologist. You are a psychologist. Then you should have a MOU with the psychiatrist. Then with whom and all we should have MOU. That is, if I get clients, I give it to you. When you get client, you give it to me. This kind of MOU, a psychologist with whom and all he has to put. MOU means memorandum of understanding. A memorandum of understanding, it is signed by two people, stating that this is what I will do and this is what you will do. A contract. So a psychologist with whom and all he should have a MOU. Psychologist. Definitely with a psychiatrist. Yes. A psychologist should have a MOU with a clinical psychologist also. As a psychologist, you can do only screening. You cannot prescribe. You cannot give it writing, in writing that he is having severe PTSD, that you cannot write it. So a psychologist should have a MOU with the clinical psychologist and also a psychiatrist.
For diagnosing.
So that when appropriate, wherever appropriate, you can refer to clinical psychologist and also to psychiatrist. Usually psychiatrist first. Psychiatrist he himself will have, every psychiatrist will have a clinical psychologist. Because a psychiatrist will not sit and do all the assessment. Because a psychiatrist will not have time for that. So he will be having only, he will be having clinical psychologist. Then simultaneously counseling should happen. Psychiatrist is a doctor after completing MBBS, a person who has completed a diploma in psychiatry. He is called a psychiatrist. So a psychologist and a clinical psychologist should have a memorandum of understanding so that you may be able to refer them. Yeah, Karthikeyan, please go ahead.
Sir, the clinical psychologist can diagnose the diagnosis, sir?
Yeah, they can diagnose. They can even prescribe. They can write a letter. They can give it in writing that this person is suffering from PTSD. And I have applied, we have on the scale, we have given this particular assessment. On the assessment, he has scored this. So he is being referred for further treatment. This a clinical psychologist can say, a psychologist cannot say. A psychologist can only refer to the psychologist, but he cannot give it in writing. He may not be able to. So, as far as the PTSD is concerned, rapport building, understanding the core issue, assessment. After assessment, maybe he is referred to a psychologist, and psychologist will tell, okay, you you give counseling also. Okay. When they say you continue with the counseling and I will give medications. So when I start counseling, the counseling starts with first with the contract between the client and the therapist, a contract. After the contract, we choose the therapy. Many people told CPT, okay, CPT and CBT, cognitive behavior therapy. Many people told many other exposure therapy. Exposure therapy is one part of CBT. Okay, so there are various therapy people have given. Actually, for PTSD, eclectic counseling is the best aspect. Eclectic counseling. CPT is the best. CPT is the best cognitive processing therapy. It is a evidence-based therapy for PTSD. But combining all other therapies, that is doing eclectic counseling will be best in PTSD. What is eclectic counseling? What is eclectic counseling?
CBT uses eclectic aspect actually.
No, what is eclectic counseling?
You're taking the good points of various therapies and using it for the client.
Using various therapies in one therapy itself. There are two ways of using eclectic counseling. There are two aspects. One is for the initial aspect, I use one therapy. Then for the middle, I use one therapy, and techniques I use one therapy. That is one type. The other type is I in different stages using different therapy. So I may be using in initial step, I may be using motivational interviewing plus a CPT. Both I may be using.
Hello.
So that is one step. Yeah. Yes, Yashwant. Yashwant, you told something. Yes. So as Kainath Kapoor said very nicely, eclectic counseling is a combination of all the styles. Wherever required direct, wherever required non-direct. So using eclectic counseling, we can the treatment will be best. So when we say eclectic counseling, particularly for PTSD, what are the aspects can be used? Particularly in CPT. Okay. Suppose if you are using CPT, okay, what is the first step in counseling? Suppose we decide that we will use CPT. What is the first step? What is the first step?
Sir, rapport building.
Now, rapport building is over. After rapport building only we try to guess what is the problem. After guessing only we administer the questionnaire for screening. If you are a psychologist, for screening. If you are a clinical psychologist, you will administer the test. After test, you find out what is the issue. For that issue, you start creating intervention. So rapport building process, everything is what? Rapport building is continuous process till the end of the counsel. Now it is clear that he is having PTSD. Now you are going to use CPT, cognitive processing therapy. What will be the first step?
Second, we use
We have to find the proper technique.
Yeah, okay. Then Rabiat is correct. Rabiat. See, this is what, this is the complete aim of this group. Your 1 year travel, with psychological aspects, keeping in mind this only. For example, what Rabiat told, that was correct. The first aspect is psychoeducation. CPT you cannot administer to a client without psychoeducating him about CPT. So the first aspect is psychoeducation. In psychoeducation, we will tell what is CPT and what is that we are going to do in CPT, and we will tell them what are the aspects in psychoeducation, what are the aspects we will communicate. Please put in the chat box.
Addressing negative thoughts.
In psychoeducation. In psychoeducation is not intervention. Psychoeducation, what are the things we will communicate to the client? What are the things we will psychoeducate? One is about CPT. About CPT, we have to, we will tell. Apart from CPT, what are the things we will communicate to the client? Only after understanding the problem, we have started the therapy. Okay, everyone, just put what is it you feel? So during the rapport building, we will tell the client in CPT 3 things, very important things apart from CPT. The first one is, it is a collaborative approach. This we need to tell to the client. Why? We need to tell this to the client. Why we have to tell this?
We need the cooperation of the client.
Because it is a therapeutic relationship we have to maintain with the client.
Yeah, collaborative approach. That is what the therapeutic approach. We have to tell that, see, it is not that only I will be talking and you will be listening, or you will be talking and I will be listening. No. Here, whatever we do, we will discuss. You will also be the therapist and I will also be the therapist. Both of us will work together to address the issue. Number one, it is a collaborative approach. This we have to communicate very clearly to the client so that the client starts sharing the things to the therapist. Otherwise, he will not share. Isn't it? Then the second aspect is, we will tell the client that homework is part and parcel of CPT. Homework will be given to you, which you have to do it. Homework you have to do. This also we will be telling the client. Because the problem will occur in the home. When the problem occurs, he has to do the exercises which is being taught. So homework is part and parcel. So homework is part and parcel for which the client has to agree, and it is a collaborative approach. The client also tell openly what is it. These 2 aspects we will communicate to the client very clearly. And then about the basic CPT model. Now, the basic CPT model. The basic CPT model and all, those are the things I will not be training in the 1 year program. Okay. This is a discussion group mainly. Okay. So you people have to share. Here, actually, the purpose is, everybody is a therapist. It is not only that Shivakumar is a trainer and everybody is listeners. No. So, you will be putting in the group, okay, in CPT, what are the things to be psychoeducated? You will be putting, and people will read and they will give their comments. So that 1 week completely we will discuss about one aspect. so that we get a clarity about everything. We get clarity about what is PTSD, what kind of therapy it can be given. In the therapy, what is to be done, what is to be psychoeducated. After psychoeducation, what is to be, okay. Now psychoeducation is over. After psychoeducation is over, intervention will start. What are the interventions we will give in CPT for the client? What are the interventions? One of the intervention is mindfulness, visual imaginary. So, yeah, yes, yes, Mohammed. Yes. Okay. Now, I will give you 2 minutes time. Okay, I will give you 4 minutes time. Now it is 20:40. Here in the purpose of the group is to make you as therapist. Because the more you are going to listen, you are going to listen only. Action is the principle of the group. 5 minutes time. Okay. Search CPT in Google. Search CPT in Google. Okay. Techniques in CPT. Search in Google and put it in the chat box. 5 minutes time. Search and put it in the tip. First read. 5 minutes, just open and read, then put. Search CPT and PTSD. Techniques in CPT. Read, okay, and share here. Share here by opening the mic. Because you have to learn. Na? Guiding imagery, I know it. But you should tell what is guiding imagery, how that it can be helped. So that I'm giving you 5 minutes time. Do it.
In this study, we explore.
তাহলে কেমন খাও?
Okay, 2 more minutes. 2 more minutes. Okay. Okay, time is up. Time is up. Can anybody open the mic and come on the video and chat? So that is the purpose. Then you get the confidence. See, typing in the thing, anybody can do it. Na? Who is able to share? At least if you are coming on the video and sharing, that's very good. Or otherwise,
Shall I say something?
Sheila, please go ahead. Please go ahead.
The techniques.
Yeah,
in,
Sheila.
Yeah.
Mic.
Yeah. Now can you listen?
Yeah.
Is it audible?
Yeah, audible.
Okay. So the techniques in CPT are cognitive restructuring, that is to identify and challenge the negative thought patterns, and then cognitive reframing, that is to reframe the negative thought into positive light, then emotional regulation, and then self-monitoring, seeing oneself and trying to self-monitor and do the correction with the help of the psychologist. Then trying trauma narrative, I mean, what are the feelings of the client to narrate his trauma without any bias, without putting himself in the negative light, and then giving him support for emotional processing, and then teaching him self-care techniques and developing problem-solving skills, then psycho-educating and teaching him grounding techniques and the relaxation techniques.
Super, super. Anyone else? Anyone else?
Thank you.
Anyone else? Anyone else? Team, anyone else?
Yes, sir. So guided discovery is also used.
Guided discovery, yes.
So
Super.
the client is asked a bunch of questions to challenge their thoughts, and then journaling and thought records are also used to process thoughts and emotions. They are asked to journaling, and relaxation and stress reduction techniques are also used, such as deep breathing.
Yes. Yes, very nice. Sharon, your mic is off. Mic.
Oh, I'm so sorry.
No problem, no problem.
Guided discovery and journaling and thought records, and relaxation and stress reduction techniques such as deep breathing exercises and progressive muscle relaxation, and exposure therapy is also used, wherein the client is exposed to the situations that they are anxious.
Slowly is exposed.
Gradually.
So first visually we will be exposing. In the visual mind we will expose. Then in the real life situation, slowly exposing them. One of the aspects in CPT is asking the client to tell the what has happened. Every time, every session, we will ask them, okay, please tell me what happened on that day. So after the client has described, we will ask him, okay, yesterday when you told how much emotional intensity was there, today how much is there? So every day, the intensity should come. Every session, the intensity should come. See, the operation was going. When the operation was going, suddenly I regained consciousness and I saw they were stitching. First day, I gave intervention. I teach mindfulness and other aspects. The second day, again I will tell them, please recollect what has happened on the day. Now when he is telling, see, actually what happened on that day was I regained the consciousness 15 minutes before, and I saw people were cleaning, and I saw actually blood was coming now. So first few minutes he was not having any physical outburst. Physical outburst has started after 3 minutes. Again I give interventions. The next therapy session, again I asked him to repeat. Then for 5 minutes he is able to recall it without any physical, without any somatic disturbance. Without any somatic disturbance, he is able to recollect. When a client is able to recollect things without somatic disturbance, he is said to be very clear. So actually in CPT there are stages. So in first stage in treatment, okay, what is to be done on the first stage, second stage, third stage, fourth stage. There are actually 12 stages. There are 12 stages in CPT when we administer CPT. So in each stage, what is to be done? It is very clearly what you call given in CPT. In first stage, what is that we have to do? Second stage, what is that we do? In second stage, how to start and how to end the session. CPT is a structured approach to counseling. So in group, what we will say is, we will be discussing about all these things. I will not be training all these things. Okay. You people also will be putting your own thoughts, and I will also be putting my own thoughts. And for 1 week, the next week completely, in the group, we will be discussing about CPT. So we will be discussing about PTSD and how to use PTSD. And people can share anything, and any one person will give the summary of that day. Summary of the day. Today, these are the things we have discussed. And whatever people are sharing, if we go through it, it will be very easy for us to understand how to proceed in PTSD. Because so many people will tell, and we will be learning so many aspects. So this is going to be a 1 year affair. Again, I tell you, it is not one day. The session will be like this, monthly once. In WhatsApp group, everybody is a therapist. So you will be telling CPT in this particular case what are the things can be done, how you will proceed. You will tell, and you will put a voice note, and like that other people also will put, and we will be learning from them. It is a collaborative learning platform. And I will also be putting my own thought. I'll also be putting my own thought. So this is what a case study 1 year discussion group. If anybody wants to join, you can connect with your EmoCare leader. And our 8 months program, we are going to start with the play therapy. Now it is going to start on either 3rd or 4th. We are going to start it with play therapy. Eclectic counseling, we will be covering 30 therapies. And also we will be training on life coaching, training and healing. All these aspects will be trained. It is a 8 months program. It is an intensive program wherein you will be getting chance to observe counseling, which is given by me, and also a business opportunity. That is number 1. The shorter version of the diploma, we are giving a PPT and 150 recordings. All the therapists are recording plus PPT. That is only for 3 days. The charge is 8,999. All the PPT related to, now you have seen a PPT, CPT, CBT, hypnotherapy, all PPT you will be getting, and also 150 recordings about that particular topics you will be getting, along with the certificate that is expert in counseling. So that is 8,999. And 8 months program also it is going to start. If anybody wants to join, they can connect with the YMOCare leaders. Thank you. Bye-bye.